Hi, this is Peter Gopal from Visionary Management. One issue that really frustrates front desk staff at many dental offices is the number of appointment cancels and no-shows. Typically, the schedule looks okay the previous day, but then falls apart. And as a doctor, the worst feeling you have is to see an empty reception room. A knee-jerk reaction that many offices have when dealing with missed appointments is to impose a cancellation fee on patients. This can work in heavy insurance-oriented offices if it is implemented correctly. The downside of this hardline approach is that the patient may not pay and may in fact leave the practice. Even if the patient does pay, it's meager compensation for the production you've lost. In today's video, let's try to tackle 3 questions. Number 1, why do patients cancel? Number 2, how much does it cost the practice in lost revenues? And number 3, what can you do about it? So why do patients cancel? Things are dormant in dentistry. The tooth doesn't hurt at the moment, and the patient does not understand the long-term implications of postponing treatment. Another common reason is financial. Insurance issues and financial options were probably not discussed and presented correctly by your front desk staff. How much does it cost the practice in lost revenues? Broken appointments are a direct assault on your bottom line. Let's work some numbers. Assume there is 1 cancellation or no-show per day on the doctor's schedule. And let's assume doctor productivity is $350 an hour, which is a low assumption. A single broken appointment per day for a 1-hour appointment equals $350 an hour times 200 days per year works out to $70,000 per year in lost production. Likewise, assume 1 cancellation or no-show per day on the hygienist schedule. Assume hygienist productivity is 170 per hour. A single broken appointment per day for a 1-hour appointment works out to 170 per hour times 200 days per year equals $34,000 per year in lost production. The total lost production, doctor plus hygienist combined, works out to $104,000 per year. This is quite conservative as many offices lose more than 1 appointment on the hygienist schedule. So what can you do about it? There actually is quite a bit you can do. But the first question to ask yourself is, what process does your office have to reduce appointment cancels? For instance, is your team creating adequate value in the appointments so the patient will want to keep his or her appointment? Does your team have a plan to deal with patients who have a history of canceling their appointments? How's insurance and money being discussed by your front desk staff? How well have they been trained in this critical area? How will your team recover appointment slots that were cancelled on the day of the appointment? What's your recovery rate? Overall, there needs to be a systematic approach to deal with appointment cancels and no-shows. Work with your staff to come up with a process. If you're unable to develop this on your own, we'll be happy to help you. Visionary Management has developed a comprehensive 7-step process to slash broken appointments 25 to 40%. We have an inexpensive audio CD which describes this entire process from start to finish. Use the CD to implement on your own. If you need help with implementation, we do have a boot camp or a coaching program. Take the necessary steps to fill your schedule today.